I'm Zain Manan from the Migratory Peoples Refuge Project, and we're here today to talk about one of the biggest issues in Mali and how you can help solve it. We're here to assist those internally displaced peoples of Mali by helping create structured communities in which they can reside with full safety and security by supplying agriculturally based households with livestock to use for revenue and survival, raising awareness and lobbying the government to allow new communities of IDPs to be eligible for government funding, sponsorship, and protection, and improving the healthcare infrastructure in the northern areas of the country. We hope to return 25% of internally displaced immigrants back to their hometowns and territories by 2022. Here to discuss some of the background on this pressing issue is our very own Alison Rosamondo.
Thanks, Zane. According to the Human Development Report, Mali ranks 175th out of 188 countries on the Human Development Index, which, as you may be able to tell, this puts Mali in a very difficult position as a developing country. Although environmental conditions have fueled Mali's lack of development, the environment is definitely not the only reason behind its delayed modernization. In 2012, environmental pressures and tension between ethnic and political groups erupted in a coup d'etat that destabilized the entire northern region of Mali. The resulting mass migration to the south overwhelmed existing infrastructure and created a humanitarian crisis. 30% of the entire population are in need of humanitarian assistance. Insecurity in northern Mali prompted approximately 140,100 Malians to flee to neighboring countries and culminated in the internal displacement of nearly 70,000 people as of September 2018.
Since the MPRP is focused on trying to mitigate the major IDP issue in Mali, we hope to complete three main objectives with the help of the Heifer Organization and the Emirates Red Crescent Organization. Our objectives include supplying women and children with goats and sheep, building hospitals to improve healthcare, and providing emergency service vehicles to improve response time to severe dilemmas. To discuss how we will accomplish these, we'll take a call from Alexandra Toberman and meet Paul Lee and Sam Kim.
Health program, Heifer International is working in Mali to empower women and children through livestock ownership. Goats and sheep provide a sustainable and secure source of food and income to their families. Information on animal care, access to markets, and access to services will come alongside the livestock. A major concern for us with the introduction of sheep and goats is the potential for neglect or inadequate care due to lack of education. To mitigate this risk, we will be holding education sessions prior to the distribution of livestock and continuing them throughout the first year of ownership. Veterinary care will be provided throughout the 5-year program period to establish the health of herds and assist with continuing breeding. The well-being of the herd in terms of the survival rate after the first year will be our outcome indicator. Based on natural sheep and goat mortality within the first year, a survival rate above 60% for the kids would be considered a success.
Here in Mali, we are planning to build a hospital specializing in reproductive health that focuses primarily on childbirth complications and sexually transmitted diseases such as HIV. Equipment to treat cases of malaria, the leading cause of death in Mali, will also be provided to staff. By addressing these recurring issues, we hope that this clinic will be a central landmark for the communities of IDPs that we plan to settle. Construction of the buildings is set to be complete within the first 2 years of our project takeoff. To test how well our hospital is performing, we will analyze the amount of people receiving care from it on a monthly basis. We hope that the number of people admitted into the hospital increases throughout the first few months after it is implemented, showing that people are aware of its services and are using it to its full potential. After those first few months, we hope the number of cases decrease, showing the clinic's effectiveness in treating patients properly, allowing for them to not have to return too often to the hospital. The main problem we may run into is access to the clinic. Transportation in Mali is difficult as roads are scarce and the railroad system is only to be used bi-weekly for public use. This problem, however, will be solved when we implement the third objective of our plan that Sam will shed light on.
MPRP recognizes that with the implementation of hospitals in Mali comes a need for access to transportation. Mali currently relies on the mass transit system controlled by the government's Malian Transport Authority. The current transportation infrastructure in northern Mali is insufficient due to connectivity issues to southern Mali and neighboring countries. To improve the accessibility and availability to additional transportation, we are striving to provide emergency services vehicles, such as four-wheel drive ambulances, that can drive over the rougher road conditions commonly found in northern Mali. One issue that we may face is a lack of vehicle security due to compromised driver safety. Given that Mali does not currently have much transportation infrastructure aside from mass transit,
We feel as though we can anticipate a low percentage of Malian citizens to have prior experience driving vehicles and are concerned with their own vehicle safety. Therefore, we are ensuring that only authorized personnel have access to these ambulance vehicles.
To mitigate this risk of outsiders accessing the car, we would establish an unlocking mechanism similar to that of a zip car company, where only a key card would grant access to drive the vehicles. Only authorized personnel from the hospital would have entry to the emergency service vehicles via scanning their hospital ID card, thus eliminating the safety risk presented by the use of four-wheel drive cars.
We will measure the success of this form of mitigation based on the amount of times the vehicles are used in total over the first 3 years that the hospital is operating.
Thank you for the description of our final 2 objectives. We have given ourselves 5 years to complete these 3 objectives, a goal that we believe is very achievable.
We need you.
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 To aid us in helping these displaced people return to their rightful home.